Cornea might be involved in different systemic metabolic syndromes. Common ones are cystinosis, mucopolysaccharidosis, Hurler syndrome, also known as Hurler syndrome, Fabry disease, tyrosinemia type 2, lecithin cholesterol acyl transferase deficiency, immune protein deposition, Wilson disease. Out of this, these three are lysosomal storage disorders: cystinosis, mucopolysaccharidosis, Hurler syndrome, and Fabry disease. Coming to the first one, cystinosis. The inheritance is autosomal recessive. It is a lysosomal storage disorder resulting in deposition of these cystine crystals. So, in cornea there will be crystal deposition. Systemic effect is usually nephropathy. This is systemic. Second most common is mucopolysaccharidosis. It is also known as Hurler syndrome. Inheritance is autosomal recessive. It is a lysosomal storage disorder of glycosaminoglycan. There in a cornea there will be diffuse stromal haze with this is a diffuse stromal haze with punctate opacities will be there, and other ocular manifestations include blue sclera, pigmentary retinopathy, and optic neuropathy. In systemic manifestation, patient will have these facial coarseness, skeletal, mental, and heart abnormalities. Again, in Hunter's and Sanfilippo there is no keratopathy. Only in Hurler syndrome there is keratopathy. Next is Fabry disease. Fabry disease inheritance is X-linked. It is a lysosomal storage disorder of alpha galactosidase A. It is characterized in cornea. It is characterized by vortex, that is swirl golden shaped in 75% of the cases. Other ocular manifestations include posterior polar cataract, and there will be these retinal and conjunctival, these vascular tortuosity will be seen. In systemic, the manifestations are angiokeratoma. Then the patient will also complain of burning pain in extremities and GI, and also there will be cardiac and nephropathy. Tyrosinemia type 2. It is inheritance is autosomal recessive. Enzyme deficiency will lead to tyrosine accumulation. It is characterized by, in cornea it is characterized by pseudodendritic keratitis. These are pseudodendrites with crystalline edges. Patient will also, in systemic manifestations, patient will have a painful callus. This painful callus will be there, which develop at pressure points. There will also be CNS involvement also. Next is lecithin cholesterol acyl transferase deficiency. Inheritance is autosomal recessive. It is a lipoprotein, pathology is in lipoprotein metabolism. In cornea there will be numerous greyish dots throughout the stroma. It is often concentrated peripherally. Next is immune protein deposition. The inheritance is acquired. The pathology is that any systemic disease that involves immunoglobulin. In cornea, in keratopathy, there will be band shaped flake opacities at the posterior cornea. Here you can see the posterior cornea is involved. These band flake like opacity at the posterior stroma will be seen. Wilson's disease. Next is Wilson disease. It is autosomal recessive. Because of ceruloplasmin deficiency, there will be accumulation of copper. There is increased copper. These are the KF ring. If you can see, these KF ring represent a brown copper deposition at the decimates of the cornea. Decimate membrane of the cornea is involved, where it begins superiorly and then goes inferiorly. Other structures, other systemic involvement is in liver, basal ganglia, and psychiatric symptoms can also be seen. Other ocular feature is the patient can also have anterior flower shape, that is sunflower cataract. Now, the notice that KF sign is pathognomic and present in 95% of the patient with neurological signs.